Hello, Covington County. Welcome to another segment of Good News Covington County with Brother John. Folks, we've got new friends with the area, a new doctor. Well, he's not really a new doctor to our area. He's just here to talk about a service that many of you may not have known that we have available locally. His name is Dr. Brad Thomas. He's a citizen of the world. He was lived in Alexander City, North Carolina. Auburn graduate, wife from Montgomery, 5 kids, appears to be stable, no wanted posters, good man. We visited here for a few minutes before the show, and I think that he's at least mentally stable as most people I know, and much more mentally stable than I am. He is a graduate of Auburn. He did his medical work, med school at University of Alabama in Birmingham, one of the finest med schools you can go to anywhere on this planet. He did his residency and some of his other work at Vanderbilt, where his specialty was in neuroradiology. And I'm going to have to get him to explain that to me. But he's down here 3 or 4 days a month as part of a practice out of Montgomery, Alabama that has 8 doctors in it. Those 8 doctors will have a presence in the Andalusia Hospital every day. They're experts in radiology, imaging, and things relative to the back and the spine. And I'm going to have to let him kind of take over some of the dialogue, but he has the approval of Mike Holloway, which is a high recommendation. He's been invited to Mike's wood shop, and not everybody, including me, gets that invitation. He was going to talk to us an awful lot today about what they call spine interventional services. And you're going to find that covers an awful lot of ground. And pain management. Every one of us that's had a back problem has complained about the back problem, not because it was inconvenient, but because it was painful. And he's our local authority on that, along with his other 7 associates that come here. Dr. Thomas, we're so glad to have you here. Thank you for coming on. I hope I didn't overstate anything.
No, you did a great job. I appreciate you welcoming me here today.
Well, you are welcome to Andalusia.
And I felt welcome at all different parts of this community. The hospital, Mike's one of our biggest fans, as you mentioned.
Oh,
Mike.
yeah, he's a great one.
A lot of the other local businesses I like to visit and interact with. I get my hair cut in Andalusia, and I shop at the Farmers Co-op. So I've gotten to know a lot of folks down here.
Oh, yeah. We think there's some pretty fine people here.
Yes, sir.
But we think you're pretty fine, too.
Well, I appreciate it.
Now, when you were at Vanderbilt doing I guess that was part of your residency, and you did, I guess you were doing a fellowship as well.
That's correct.
On neuroradiology. Explain what that is.
Yes, sir. Well, radiology, as most people may be familiar with, not only includes X-ray, but CAT scans, MRI, ultrasound, but also interventional radiology, which is a subset where we perform minimally invasive procedures using imaging guidance. Neuroradiology, I did an extra year in that area, which encompasses diagnosis of conditions that affect the brain and spine.
Right.
We also perform minimally invasive diagnostic procedures and some therapeutic procedures pertaining to the spine.
Now, when you say minimally invasive, I have a lot of friends that have gotten to be pretty old, and they are just, I'm going to say it because you're scared going to the doctor because you're scared the doctor may have to operate on you. And there's an awful lot of things that have changed as I've gotten older, where the big holes they used to cut into you are now little bitty places they just make incisions and go and do all the work and then close you back up, and 3 days later you can be back on your feet. That's what I qualify in my mind's eye as minimally invasive. What do you mean when you're talking about minimally invasive surgery?
Just like you're saying, rather than making a large incision, we use a series of needles or catheters or guide wires and the CAT scan or X-ray or even sometimes MRI to guide those devices into certain parts of the body. So for instance, people have heard about getting a heart cath, where you go in with a catheter to the artery to get to the heart and do stents or that sort of thing.
Right.
We can do a similar type procedure to get to arteries to the brain, arteries to the liver or kidney. We can also place needles through the skin into these various organs as well to do biopsies, to drain fluid collections, some of which I've done this week down here in
Right.
Andalusia. So those are some minimally invasive procedures that can not only get information so that the physician team and medical team can treat the patient, but also to provide sometimes the first line of therapy. If you've got
Right.
an abscess somewhere in your abdomen, rather than opening you up and draining that abscess out, we can place a catheter through the skin into that as
drain it.
radiologists and drain it.
Yeah.
When it comes to the back, which is one of the things you referred to, a lot of people know there are a lot of different things that can cause back pain, but I want to try to, if I can, boil it down into some broad categories
Sure.
to help everybody understand and let them know when it's appropriate to see a physician and when you may or may not need a minimally invasive procedure or when
Right.
you may need surgery.
Can you delve into that right now?
Well, sure. Well, as you mentioned, back pain is just a large topic that we hear a lot about. We all
It's kind of like Coca-Cola. That name covers RC, Pepsi, Dr. Pepper, and everything else, but it's really not just
as you and I've said, we've had our own bouts of back pain
Right.
ourselves. We all know people who have. I think 80% or higher of folks in the community would say they've had back pain
Sure.
or neck pain at some point. And I think the most recent data says about 12 to 15% of doctor visits have to do with back pain.
wow. That's pretty significant.
So the good thing is a lot of back pain can resolve on its own within 4 to 6 weeks with
Yeah.
just the things we all do, rest, heating pads, massage therapy, sometimes physical therapy is indicated,
Right.
anti-inflammatories. But other folks don't get such relief and they suffer from chronic pain that can be debilitating. And for those patients, we like to educate them on what the options are.
Right.
Most of the time you'll hear that after about 4 to 6 weeks of a back issue, you'll probably be getting some type of imaging test if you hadn't already,
Right.
meaning an X-ray, a CAT scan, or MRI. X-ray and CAT scans are good to look at the bones. The MRI is good to look at the structures such as the discs, the nerves, and some of the ligaments and that sort of thing.
Softer tissue.
The softer tissues, yes, sir. So we do all that, at the hospital and at imaging centers where we send the
Right.
report to the physician, and then the physician will kind of use that as part of the puzzle to assimilate a diagnosis and then help you decide what's best for you.
Now, just to ask at this point, it's my understanding that Andalusia Health over there has got some of the best imaging equipment, state of the art right now,
We sure do.
that they can be had anywhere. So there's no need, if you need imaging, to go to Pensacola or Dothan or Montgomery for most of what you need. That can be done on the equipment here. Is that
I would
correct?
second that. We've got a great MRI machine, one of the top of the line CT scanners that was just installed this
Right.
past year. With our group, as you mentioned, we've got somebody here on site each day to interact with the physician and generate a report within an hour of the
Right.
time you have your exam. The other good thing is I'm a neuroradiologist. We've got others that specialize in other areas such as bone radiology. So if there's a question, we can collaborate and discuss the case over what we call teleradiology. We can send the images back and forth so we can give you an expert read
What a nice thing for
on whatever
Andalusia to
type of
have.
imaging you got. So I do think our
Yeah.
imaging services are top notch here. And also just to put a plug in for mammography and the other services for
Right.
women, we've also made some great strides in the past years for that
Well,
as
that's
well.
great. I mean that. That's
So-
just a wonderful thing to have.
We're excited about what's going on here.
Asset to the community.
Yes, sir. So
Get back to the.
So going back to the back pain, first of all, there are some things that should let you know that there's an alarm that you need immediate medical attention. One is if you have an accident, a fall, or a car wreck, and you've got severe back pain, you need to go to the emergency department.
Right.
There are other things such as back pain accompanied by fever or loss of function of your legs that should prompt you to seek medical attention. We mentioned some of the other more chronic pain issues that you've been dealing with. You finally may get plugged in, seeing your doctor, and they send you for a test. Well, then the question is, what's next? So people a lot of times are concerned about getting further into that process because they don't want to. For instance, I've got an uncle that didn't want to be taken off his truck driving
Right.
job, or didn't want to be on pain medications because they can't function, and they're kind of worried about surgery.
Right.
So For some folks, they may eventually need to see a surgeon, and because some things that just the mechanical compression upon nerves,
Right.
May not resolve on its own or with medication. But some folks that have elements such as problems with their discs or their joints will
Right.
respond favorably to injections. And that's one of the areas where I feel like I specialize and can offer some services to the
Can we
community.
pick up on that in a minute?
Okay,
After a
great.
break? Thank you. We'll
All
be
right.
back after a short commercial break. Welcome back to Good News Covington County with Brother John. Got with us today Dr. Brad Thomas. He's a radiology specialist that works for the group out of Montgomery that has someone assigned to Andalusia Hospital every day of the week, so that you don't have to go when you've got a neuro or radiological situation that's a little bit different. You don't have to go out of town. With the imaging equipment they've got over here and the knowledge that his group brings out of Montgomery down here every day, we're just like the really, really big hospitals in Montgomery, Birmingham, Dothan, and Pensacola. And I know y'all say, well, that just can't be so. Well, by golly, it can be so. We're in the age of modern communications. Everything they can see can be communicated by the internet, live, real time. If they're not even here, they can get on a conference and have the very same information in front of them and 3 other doctors. If they have to, if they have to consult with each other, they can do it live, just like you're in their office in Birmingham, Montgomery, anywhere. This little hospital in Andalusia may not have 17 floors, but its capacity for doing good for you is pretty significant. That's one of the great things about moving forward. One of the great things about moving forward at Andalusia Hospital and Andalusia Health is the lineup of personnel that John Yanes has brought into this town to help these physicians here do an even better job. That's where I go when I have problems now. I used to go to Dothan. No need to. It's right here. Good people like Dr. Thomas here are leading the way. Now, we were talking about a minute ago minimally invasive procedures, and right before we went to the break, we were talking about injections and that kind of stuff.
Yes, sir.
Can you follow that out? And then I noticed that you brought part of who is that part of?
Let's
Dick
see.
Cheney? No.
We didn't take this away from Mike Holloway. He's still got all his
Okay,
vertebral bodies.
well,
So,
Mike wouldn't miss it.
yeah. I think he'd do okay without it.
Yeah,
Whatever he's dealt with, he can.
yeah,
And you're right about Mr. Yanes has got a great vision for the hospital
he
and
surely
the
does.
community.
We're fortunate to have
And
him.
we're excited about what's going on there. And in addition to what I'm about to talk about, we've got some other services that we might be able to offer in the next year or two. So maybe we can be back and talk about other things.
Great, we
in the
look
future.
forward to it.
But as we were talking about the spine interventional services, and when I say spine intervention, most people know about epidurals, nerve blocks. Those are kind of some of the other terms for
Right.
spine intervention. And what we do is we try to educate the patient when they come to see us, so they know what they're getting into.
Right.
The doctors also have our information and kind of our flow diagrams of how we like to view
Right.
the problems of low back pain and how we approach it. But I bring this model just to kind of show you, if I can, because we like to think in 3 dimensions in radiology.
Right.
When we're looking at CAT scans and MRIs, and also when we're doing these procedures on the patients.
Sure.
But when we talk about chronic low back pain, we're talking about really a couple of broad categories that causes back pain. I'd say about 75% of all low back pain is either going to be from degeneration of the disc or from arthritis in the joints.
Okay.
So just to kind of hone in on that a little bit more, the discs are these types of gelatinous soft structures in between each bone
Okay.
here.
On folks out in the audience, he's pointing to
This kind of
area right in
yellow
here.
color here.
Yeah.
That's got a little bit of a lining here that's fibrous and tough, and it's got some more toothpaste or gelatinous material within the center.
Does that
All
kind of
right?
act as sometimes a shock absorber?
That's exactly
or
what
something
it
like
is.
that?
That's a cushion or a shock absorber.
Right.
And most patients that aren't having back trouble, it's an amazing thing that they don't perceive their back, moving and,
Right.
and going through all the stress that it goes through. But after some wear and tear, you get some degeneration or disease of that disc, that lining, and the disc can bulge. Now, not to get into all the different terms for disc herniation, But when that disc bulges or herniates, it can then pinch these nerves. Everybody's heard of a pinched nerve.
Real painful.
And these nerves, the way God made us, they flow through this bony canal and they're protected. And then when they come out, they go do their various things, whether it's provide sensation or strength to the legs or other structures.
Now,
So
is that what these yellow?
that's right, John.
Yellow
These
color-
yellow structures here represent the nerves. The one in the middle, the large one's the spinal cord.
Spinal
So your
cord
spinal
itself.
cord comes down, and then the nerves branch out
Right.
at the various levels, we call them. So what we want to do is, by knowing their information from MRI, target the nerve that's affected.
Right.
Now, when I say target the nerve, the disc is maybe pushing on the nerve, and so that inflames the nerve.
Right.
So you got a little bit of a mechanical compression, which people understand, but you also got an inflammatory response.
Yeah.
That inflammatory response can respond to steroids. So some folks can get steroids by mouth. That has some side effects, makes you want to eat more, makes you not be able to sleep as much.
Right.
So we like to target an injection of steroids right in the location so we don't have to use as much, and it's really contained in that area with less side effects.
Right.
So what we do is we use live x-ray, and we take clean you off, numb the skin up. After that, most folks say it's just pressure.
Yeah.
And we place the needle right into the specific location, whether it's a epidural injection or it's a nerve block, where we're going a little bit more specific to the nerve,
Right.
and inject a combination of numbing medicine and steroid.
Right.
So that's one of the more common procedures we do. One of the
Totally non-invasive.
and it takes about 5 minutes.
Yeah.
Patients will be amazed. There's really no restriction afterwards. We tell you not to, go dancing or play football immediately just because you have some numbing medicine on board. But I've had even physicians that I've done this procedure on go ride bikes afterwards. That wasn't recommended.
Yeah. Well,
But sometimes they're hard-headed,
some
right?
people are just
Yeah.
knuckleheads.
But, it usually takes about 2 days for the steroids to start working. Some
Right.
folks, though, notice some immediate benefit. And then we go from there. So it's, in a sense, it's a diagnostic procedure, too, because it tells us if we're treating the right area, whether you get benefit.
Right.
And if it is, it provides you some relief, which may last for weeks to months.
Well, I know they did something like that for me years ago, and I've not had a flare-up since.
Is that right?
Yeah. I mean, I was lucky, I guess.
We have some patients like that might just need one or two, and you don't see them
Yeah.
again, and they're great. I have
Yeah.
some coworkers here in Andalusia. That's the exact same story that they tell.
It's wonderful work. I've not had you obviously, but I know what good it is
Yes,
and
sir.
how much
Well, it's
help I had.
and it's a pleasure to be able to provide that kind of
Yeah.
benefit for folks. The other thing, when I mentioned the joints and the arthritis, these joints in the back of the spine are called facet joints. And, after just years of movement there,
Right.
they kind of get inflamed. They've got a lining of those joints just like your shoulder or your knee, and just like you get arthritis in your shoulder
Right.
and your knee, you get arthritis on these joints. Well, similarly, once we diagnose that by doing our history and physical exam, looking at the imaging, we can target these joints with steroid therapy, for one thing. But it can come back. Some folks, they got arthritis, it's not going away. We can treat the symptoms.
Right.
But if they get response to the steroids, we can then do a nerve block on those joints, which in a sense numbs the nerve up that goes to the joint, so it takes away the signal that goes from that painful joint to the brain.
Brain.
And if the patient said, that helped, doc, then the next step would be to do an ablation of that nerve.
Now, an ablation is when
Ablation
you go
of
in
the
there
nerve.
and actually
You actually,
do some work on the nerve
you
itself.
actually can destroy or interrupt that nerve
Right.
in a non-surgical fashion.
Yeah.
So what you do is, similarly to your other injections, when you place the needle down, at this time you place what's called a probe that has radio frequency
Right.
generator attached to it.
Right.
That sends a radio frequency signal. It heats up the probe, and that, in a sense, just uncouples that nerve.
Now, one of the that sounds scary, but I don't think if I was in back pain, that'd be great with me. The body, God created us in such a way that we've got a lot of redundancies for everything that goes on with that. That nerve ending. I'm not a doctor, and I didn't sleep it all day in last night. And I don't pretend to be one, but I think I got common sense enough to understand that one nerve may be what's causing all the problem that you're feeling from your back, and if they can do that ablation,
An ablation.
then they can stop that pain. But all the other, y'all are now able to go in and just touch that nerve, and all the other nerves around it are unaffected. Everything else goes on, but your pain stops.
That's a great point. And in order to make sure we have safety in doing so, not only our knowledge with the radiology and knowing exactly where we are by visualizing that probe going to the right spot, we actually do some nerve testing. So we stimulate the nerve. Sometimes it reproduces the pain, but more importantly, it shows that there's no stimulation of the nerves going down the legs.
Right.
So then we know in the right place. The other thing is, some people say, well, is this permanent? It is not completely permanent. Nerves can grow back, although slowly. So instead of coming for a steroid or injection or a nerve block every month or two, this may keep you away from us and needles for another year and a half.
Yeah.
So it can extend
nice.
your benefit. So that's one thing we're excited about. And other things that we're excited about going forward is also procedures that we commonly do where we place cement into the bone when there's a fracture.
Now, can you explain that? Because I think there's a lot of people that are like me that've got little bits and pieces of bones floating around that you know they're worried about, and if they're not causing any problems, I wouldn't worry about them. But y'all can repair some of that kind of stuff minimally, can't you?
That's one of my favorite procedures. And usually, if you've got a fractured vertebral body, this white bone right here, you're going to know it because it can cause severe debilitating pain. It's usually older patients that have osteoporosis, which we've all heard of, where the bone gets weak, part of aging. Some patients are more susceptible than others. It's important to be in with your primary care physician so they're monitoring your bone density, we call it, to know who's at risk, because there are some therapies to prevent the fractures, in addition to lifting precautions and those sort of things. But we want folks to be active, because being active produces a low-level stress on the bones that keeps them strong.
That's right.
Once you get a fracture, you're not going to want to be active. You're going to be a setup for stuff like blood clots, pneumonia, and other things. So we want you to get back on your feet as able. So one thing is just the normal conservative measures like back brace and pain medicines and those sort of things. But putting the cement into the bone, John, through a needle by using the imaging guidance, seals the fracture. That prevents the bone from rubbing on each other. That prevents the pain. And it also prevents further collapse.
That's
so
wonderful.
Those are two amazing things
Now,
that can be done through one needle.
Typically?
That
I mean, I'm
procedure-
sure they're depending on the amount of damage done, the age of the patient and all that.
If we're doing one bone, John, and depending on whether we try to put a balloon in there to expand the bone or just put the cement in, it can take 15 to 30 minutes. You have minimal sedation, if any, to keep you comfortable. And then you leave the hospital, hopefully walking out in 2 hours.
Under your own power.
In 2 hours.
Wow.
So that's one exciting thing that I mentioned we might be looking to do in the future here. Right now, the interventional spine services go through your primary care physicians, and they know how to get in touch with us. And we're always happy to review any patient circumstance situation to let them know how we may be able to help offer.
Well, we're about running out of time.
Okay.
But I want you to make me a promise.
Yes, sir.
That you'll come back on here and you'll talk more with our audience about what y'all are doing out there. And maybe about pain intervention, what y'all could do along some other avenues, because I know people that just can't seem to get over the pain. They may not have been to see you.
Well, we'd be happy to talk to you more. And if you have questions, like I say, you can speak with your primary physician. We've got a good relationship with all the primary care doctors. We have wonderful primary care doctors that serve as the quarterback for the patient care, and they'll let you know whether or not you might be a candidate for something that we've talked about today.
Well, Dr. Thomas, we really appreciate you coming on. Thank you for being so informative.
Great.
Look forward to seeing you again. Glad to have you in Andalusia.
Thank you, John.
Take care.
Take care. All right.
Good job.
Thank you.